Hi guys, thank you so much for joining me on WellnessKE. My name is Fatma. Here on WellnessKE, we like to offer women great information and solutions to balance their hormones through fitness, nutrition, and most importantly, a more holistic approach. Now, I want to welcome you to the third and final part of our conversation on fibroids. Remember, if you haven't watched the first part of our conversation on fibroids, you can click right here. And if you haven't watched the second part of our conversation on fibroids, you can click right here as well. Now, in this video, we're actually going to talk about three very important points for you to consider. Number one, treatment options for fibroids. Number two, we're going to talk about factors to consider when you're thinking about your treatment options. And most importantly, we're also going to talk about ways that you can be able to manage fibroids. So what are we waiting for? Let's get to it. So, your treatment for fibroids is actually going to be determined by some factors that are very important for us to discuss. So when you're thinking about the treatment options, or when your doctor is actually prescribing some treatment options, there are some factors that they are going to consider. Number one, it's the size of the fibroids. So if your fibroids are too large, then chances are your doctor is going to prescribe a surgery for you. And if your fibroids are quite small, then they might actually either use a laparoscopy method, or they might be able to give you some type of treatment that does not involve an operation. Let's move on to the second factor that they are going to consider: the location of the fibroids. Where the fibroids are located is going to determine the type of procedure or treatment method your doctor is going to use to help you with your fibroids diagnosis. So if they're located in an area where they need to be, accessed through surgery, then they might opt for that. But if that's not the case, then they might go for another type of treatment option, depending on where your fibroids are located. Another factor they are going to think about is your desire for pregnancy. If you do have a desire to have children later on and you don't have any children, or you'd like to have more, then you need to communicate this with your doctor as you're talking about treatment options, because then your doctor can find a way to ensure that they actually come up with a treatment method that's going to be able to allow you to have your reproductive organs intact so that you can be able to have children. Another factor that they're going to consider is uterus preservation. So even if you really don't necessarily want to have children, but you'd like to have your uterus preserved, this is something that you need to communicate with your doctor so that they can be able to know when they're coming up with a treatment option for you, they need to know that you do intend to preserve your uterus. It's also important to know that your doctor knows best, so they're going to advise you what's actually going to work well for you. In some cases, some women end up having too many issues because of their fibroids, or maybe the doctor suspects that these fibroids could lead to further complications or risks, and so because of that they might give you a treatment option, and it's important for you guys to actually discuss the pros and cons of this treatment option. Another factor your doctor is going to consider is the symptoms. For instance, if you have fibroids and your signs and symptoms include heavy menstrual periods and it has caused you to actually become anemic, then maybe your doctor might not necessarily opt for an extensive surgery, because then that means you're going to lose more blood and you already have that issue. So this is just to give you an idea of some of the factors that your doctor is going to consider when they're actually choosing a treatment option for you. So now let's briefly discuss your treatment options. So it's important for you to know some of the treatment options that your doctor might suggest if you have fibroids. And there are different kinds of treatment, but I want for us to start from the very beginning. One of the treatment options that your doctor might actually opt for is known as watchful waiting. Basically, this means that your doctor has actually discovered that you have fibroids, but you don't show any signs and symptoms, so he or she does not see a need for them to take any action right away. So watchful waiting is actually recommended most of the times to women whose fibroids show no symptoms and they're not necessarily affecting them. So they don't have heavy menstrual cycle, they don't have pain, they're not losing any too much blood during their menstruation, they're not anemic. And so because of this, your doctor might tell you just go back and wait so that, you know, they see. Sometimes they say that women's fibroids actually end up disappearing. And so this is more or less like they're hoping that something like that is going to happen. Personally, let me share for me what happened is I was diagnosed with fibroids and I had a pea-sized fibroid, meaning it was quite tiny, the size of a pea, and there were no signs and symptoms. And the doctor actually told me to not do anything about it. He did not actually say he was going to do anything about it. And so for that reason, we didn't actually end up taking any, you know, I wasn't prescribed any medication, any treatment, and so we did what we call watchful waiting. But I have to mention, because of the watchful waiting, I ended up having more fibroids. They grew in size, they grew in number, and this is because, of course, I was still, and I still am, in my reproductive age. So I kept on having my menstrual cycle, and because of that, I was exposed to high levels of estrogen. So I just wanted to mention the fact that watchful waiting is one of the options, but it's important when you are doing the watchful waiting for you to find ways to make sure that you balance your hormones. Something else that doctors might prescribe is medication. And in terms of medication, there's this type of medication known as GnRH, or they might prescribe some type of hormones so that you can be able to balance your hormones. Or if they find out that there's high estrogen, maybe they might give you something that boosts your progesterone so that they can be at par. So medication is also one of the treatment options. Another treatment option could be surgery. And by surgery, we have different categories. There's a laparoscopy, which is a minimally invasive surgery, meaning you're not necessarily going to have that cut. It's minimally invasive, but then the doctors can still be able to, you know, get rid of the fibroids. You also have a myomectomy, which actually happens to be, you know, an extensive surgery where the cut is actually made. It's quite deep, it is an extensive surgery, and your doctor might opt for this type of surgery depending on the size of the fibroids, the extent, you know, the havoc that the fibroids have caused in your body. They might actually, you know, recommend a myomectomy. And also you have a hysterectomy. A hysterectomy means that you're going to have the type of surgery that is not going to be a conservative surgery, meaning you're actually, the doctors are actually going to remove your uterus. So this is just, you know, for you to know that these are some of the options when it comes to surgery. This is very important. Another method that the doctor might use or prescribe for you in terms of treatment could be device therapy. I'm sure you've heard of an IUD, and an IUD is actually one of the ways that a doctor might prescribe treatment for you. But of course, as they are prescribing any kind of treatment, ask as many questions as you can. Find out, you know, the pros and the cons and what you need to expect as you go through that treatment. Another treatment option is actually a medical procedure, and one of the most common medical procedures is uterine artery embolization. Now, when you get the time, it's important for you to research all these treatment options, and once you've researched these treatment options, you'll actually know which one works for you depending on the type of fibroids you have, the size, you know, the number of fibroids, where they are located, and also your desires. Maybe you desire to have children, so then that means you cannot have a hysterectomy, meaning you cannot remove your uterus. So I really want for you to actually speak to your doctor whenever they propose a treatment option. Ask as many questions as you can. That way you can be able to be fully confident in the treatment option that they prescribe for you. Now, I want for us to look into the management, ways that you can be able to manage fibroids in a natural and holistic way. So here at WellnessKE, we love to offer women solutions that are natural and have a holistic approach in order for them to maintain their reproductive health. So I'm excited to share with you some natural and holistic methods that you can use in order for you to prevent, manage, or even avoid a reoccurrence of fibroids. Okay, let's start with the very first one. So we start with the very first one, your weight. Remember when we mentioned that women who are obese or overweight actually are more susceptible to having fibroids. So it's important for you to actually check your weight, make sure that you are maintaining a healthy weight. So meaning you're going to include some physical activity and some movement in your day-to-day life. And if you want to know whether you are obese or overweight, remember you just check your weight, check your height, find your BMI or your body mass index, and if you are 20% heavier than the normal healthy weight, then know that you are obese or overweight. So maintain your weight. And one of the easiest ways you can do that is by including some physical activity in your day-to-day life. And if you're wondering how you can be able to do that, we have a solution for you. We actually have our 30-day fitness plan that is amazing for many women, so that they can be able to stay fit from home, and they can have an accountability coach that takes them through all kinds of exercises. And also it's important to mention that our 30-day fitness plan also keeps in mind the importance of hormonal balance, because exercise also does create some kind of stress to the body. So it's important for you to find workouts or exercises that are going to also be able to ensure that your hormones are balanced. So make sure that you look out for that. Let's move on to the second one. The second one is your diet. It's important for you to look into your diet and nutrition, because the foods that you eat actually do affect your levels or your hormone levels. So eating foods that have low sodium, not very salty foods, avoid any processed foods, eat more cruciferous vegetables like cabbage, broccoli, cauliflower, Brussels sprouts, because these foods actually help to rid off the excess estrogen that is in your body. And as we mentioned, high levels of estrogen do cause or are directly linked to fibroids. So eating more cruciferous vegetables, avoiding the processed foods, avoiding junk food, avoiding foods that are high in sugar as well. It's very important for you to eat foods that are not going to keep on spiking your insulin levels. And we actually have a video, and I'm going to link it right here for you to be able to watch on PCOS, that's going to explain to you, the type of foods that you should be eating to avoid, issues related to hormonal imbalance and also high sugar levels. So that's something that you can look out for. And if you're looking for an amazing nutrition plan that can be able to help you, here at WellnessKE, we actually have a nutrition plan that is able to help you in balancing your hormones. It's a 30-day nutrition plan that's going to take you step by step, so that you can be able to know what foods to eat, what foods to avoid, and ways for you to balance and reset your hormones to gain your energy back, to actually help you in managing any kind of signs and symptoms, and actually lead you to a better and healthier life. So make sure that you look out for that. The next one is checking your hormones. Now, we've mentioned that fibroids actually happen to be a hormonal imbalance issue, and high levels of estrogen are directly linked to fibroids. So that means that it's important for you to, balance your hormones in the most natural and holistic way. And also it's important for you to know what causes these hormonal imbalances. Sometimes we should actually be very careful when it comes to the products that we use on our skin, like our skincare products, our beauty products, also the products that we use to clean, like cleaning utensils, cleaning the house, because some of these products are actually loaded with what we call xenoestrogens. And xenoestrogens are actually just these chemicals that are found in these products, and unfortunately when they do end up in our system, when we inhale them or we take them maybe as a skincare product, you apply it on your skin, unfortunately what happens is they end up mimicking estrogen in your body, and so you already had estrogen and these products actually went and overloaded you with more estrogen because they end up acting like they are estrogen. So that mimicking of estrogen causes you to actually have high estrogen levels. So it's important for you to know that. Find products that are actually going to be natural and safe for you, and also find ways that you can be able to. So if you are interested in purchasing our green tea, please feel free to let me know in the comments section below, and we'll be happy to start your wellness journey with you. Another one is increasing your vitamin D intake. So foods that are rich in vitamin D, or if you can find a supplement and you've talked to your doctor about this is one of the natural and holistic ways that you can be able to prevent or manage fibroid symptoms or avoid a reoccurrence. Another natural and holistic way for you to manage fibroids is through detox. It's important for you to do a proper detox in order for you to assist your liver in cleansing your body. This is because, as we've mentioned, there are many products out there. There's the environment that actually loads up our bodies with toxins. So if we don't assist our liver by doing a proper detox, then we're not necessarily boosting its functionalities. So a liver detox is also one of the ways that you can be able to manage fibroids, and there are many ways that you can be able to do that. Make sure that you also speak to your doctor through your consultation, so that they can be able to give you a go-ahead if you're going to use supplements. This part is really important. And last but not least, stress management. And I know that this one can be a hard one, because I've spoken to so many women, some of my clients, who have shared that they're not able to manage stress because life keeps happening. But it's important for you to know that stress is one of the reasons why women end up having severe symptoms of fibroids, or even fibroids in the first place. So managing stress through doing some meditation, some yoga, taking a brisk walk, and also just making sure that you take care of yourself from a wholesome point of view. This is going to help you in managing fibroids. Now, there are more methods and there's so much more information, but of course we wanted to try and fit in the most important in this amount of time. So if you have any questions regarding fibroids, please feel free to reach out to us through our social media handles, and we've actually shared the links in the comment section below so that you can be able to reach out to us. Ask as many questions as you want so that we can be able to assist you in achieving your health. Thank you so much for watching this 3-part series on fibroids, and this conversation needs to keep on going so that more women like you can learn more about reproductive health. I want to remind you, if you want to start your fitness journey today, please feel free to start off with us. We have a 30-day fitness plan that can be able to help you in staying fit and balancing your hormones from home. And also, if you want to eat well and learn healthy habits for life, then make sure that you subscribe to our 30-day nutrition plan that can be able to help you in balancing your hormones. And right here on our YouTube channel, we also have great, amazing fitness videos that can be able to help you to start your fitness journey from home. Make sure that you check out our social media handles in the comment section below. And I want to remind you to click that like button, because liking makes YouTube share this video so that women like you can learn more about reproductive health. And here at WellnessKE, learning never stops. We love to keep sharing good information so that women can be able to learn more about reproductive health. And we have a great video on PCOS right here. So make sure that you click on that video and learn more about this condition. Thank you so much for watching. Subscribe to the WellnessKE channel so that you can know every time we post a new video. My name is Fatma. I'll see you next time.